Models are changing. What people need in healthcare is changing. What we're able to provide in this industry that is really, in terms of business, a huge challenge is changing. And so to be part of an active project to reinvent what healthcare is going to be in this community was very exciting and energizing. And to jump right in on day 2 was thrilling.
It's been very challenging to sustain a 70-year-old building that is very inefficient and is in constant need of repair. We've spent most of our capital funding on infrastructure just to maintain the building, keep it safe for our patients, our visitors, and our staff, and to meet regulatory compliance. We're not very operationally efficient. The current design was built for 88 patients, and our current average daily census is 3. Both of our clinical units are on different floors and on opposite ends of the building, so we can't run very efficiently. We can't share staff. So out of that need, we have come to realize that we need a new facility, and we need help deciding what a facility needs to be in a small rural community in North Carolina, because we feel like the design needs to be very unique. When I arrived here in 1981, we were an 88-bed hospital, and every bed was full. That was when patients could come to the hospital and stay as long as they wanted to. And then in the late 80s was when the DRG system of reimbursement went into effect, and we just could not continue to be viable with the reimbursement cuts associated with that, because we were spending a lot of money as a small hospital to take care of Medicare patients, and they had cut our payment. So that was a really big change, and we struggled with, what are we going to do? Well, in 1995, we merged with More Regional, and then in 99, we became a critical access hospital. We also decided that the reimbursement for skilled nursing residents was much better than for hospital patients, so we converted some of our beds into a skilled nursing facility. We opened a 51-bed nursing home section of the hospital, and that kept us going for a few more years, and then that reimbursement changed, and over time, things have just been cut and cut. Now that we announced that we had the grant, and it's a planning grant for reimagining healthcare in our small rural community, they all realize it really is going to happen. And there are some other projects going on in the community. We're getting a new high school. So folks are realizing that new things can happen, even though we are in an economically depressed area. And so there's excitement. People are trying to decide where they think the hospital needs to be, and calling me and willing to talk to me about land sales. One of the towns has talked to me about donating land out on the new bypass. So all that is just great stuff.
The real value in this project is uncovering the learning and the understanding around what is really important to think about when we design rural facilities. Many of the services and resources that we're trying to connect to the healthcare system presently are disconnected. And so what we do is we take a facility that was designed for a different era and a different time, that exclusive focus on medical care, and we try to add in all of these other elements that were never designed into the facility, that were never designed into the campus. And so at the end of the day, it just doesn't fit. And what we end up doing is trying to force fit connection between things that should be connected, but have barriers to becoming truly integrated due to a facility and a campus design. It's not the total cause of the problem, but I think it's certainly something that inhibits the ability to integrate services effectively. So the promise and the potential is that we can begin with a blank slate, and this is really an exciting opportunity to do just that, to say if we were to rethink and get away from set aside what we presently have and think instead about what we ideally would like to have. It's an exciting opportunity, and I think it will stimulate some important conversation and the opportunity to really give sufficient time to that conversation, to hearing from the community, to hearing from research and understanding around what's worked in other states, what's worked in other countries. All of that can inform our thinking so that we can come up with the best possible design, and then we'll continue to learn as we go. But it's the learning and the insight and the understanding that I think will not only benefit Troy, but it's going to benefit communities across North and South Carolina and truly across the country. Because I think at some level, communities across the country are struggling with some of the same core problems. We may not understand all the solutions through this project, but I think it's going to get us a significant way down the road toward a new understanding.